Well, boy, you know, I'm going to have to, I can't talk too long because he's probably going to run over 15, 20 minutes. So, but Greg got done early. I was really surprised. He stole some of my wind too. He wanted to get off in hog cholera, not hog cholera, but salmonellosis and erysipelas one. I thought, oh, that's okay. You know, use my same slides. That's okay, Greg. He came up and swiped them from my carousel. Well, I don't know about that. Well, what we've done is we're clearly it's really not possible in an hour's time to do any kind of extensive discussion of skin diseases of swine, and so that was an excuse for me to kind of limit myself to talk about some of the material, some of the stuff that I had materials on, and that I thought might be of interest. So. There's not much in terms of exotic. Those of you that are in swine practice or exposed to a diagnostic lab in which you have a lot of swine probably have seen many of these conditions, so it's not going to be new to you. On the other hand, I understand we have some people that are mainly from places where they don't see a lot of swine, and so this might be an opportunity to see some unusual diseases. I've given a handout here, and what I thought I'd do is I only made 20, and there's another one over there. And what I thought we'd do is pretty much these cover my slides pretty much intact. And what I would do is I wasn't sure how many people were going to be here. So what we'll do is this. I have the masters, and if you didn't get one, you'll get one. You can get one. I'll have some more made up, and we'll hand them out tomorrow or wherever. So you will get them. And so if you can just jot down notes on another pad or whatever you have here, and then we'll fill in. And pretty much what's on here is what's on the slides, and that's about what I'm going to talk about. So, as I say, I've kind of limited myself to what I am going to cover, to what I have materials on, and what I thought might be of interest. Why don't we hit the lights there? And let's see, Leon, I'm probably going to need a little bit of some transparencies. Now, I was going to use a high-intensity projector. I hope you'll be able to see on the left here. Is that on, Leon? Here we go. Okay. And so I was going to try and do this whole presentation on transparency, using the computer, but it just wasn't going to work. Is that going to be too dim for the people in the back? You're going to be able to make it? Okay. Okay. Well, what I've done here, I pretty much picked several topics. Now, it's unusual to give the miscellaneous diseases first, isn't it? Most people stick to miscellaneous at the end, but I thought, well, these are a couple of interesting things. And certainly Dermatosis VEGETANS, I see we have some people from the UK here, and they may even be able to provide us with some additional information, because this disease here developed originally in the Scandinavian countries, and I believe you imported it into the UK about 1953 or so, and then you exported it to your Canadian colleagues about in the 60s, I think. I don't know that I personally have seen a case of it, certainly not since I've been here at Purdue. When I was a student at Michigan State in the 60s, I did see an example of giant cell pneumonia that came through, but I don't remember if there were any skin lesions associated with it. So we picked a few of these common diseases. The first one I'm going to say a few words about here is PITYRIASIS rosea. And let's flip here. PITYRIASIS rosea is really probably the name now has been changed, or at least what they'd like to refer to it as porcine juvenile pustular psoriasiform dermatitis. Take a deep breath. It's a rather long name. It is more descriptive of what the disease looked like, and PITYRIASIS rosea really refers to a human disease, and they are not exactly comparable. People that originally saw the disease thought they were similar, and thus the name was attached to it. It's also been referred to, Bob Dunstan at one time was referring to it up at Michigan State as transient annular dermatitis of swine. But I think Scott at Cornell, I believe he's responsible for the current name of the disease. Well, the disease itself is a transient non-pruritic dermatitis. And it usually is seen in 4 to 6 week old pigs. It's mainly an aesthetic problem, at least in my experience and the people, the practitioners I talk to. It is self-limiting and no treatment is required and it disappears. The cause is idiopathic in a sense. We just don't know what causes it, but there certainly is a familial tendency in the case of this disease. This is an animal with fairly advanced disease, fairly advanced lesions. The disease itself, grossly, The initial lesions themselves will start off as sometimes as small papules. Now, I don't have a good example. This was taken from a series of pig out here at West Point, which is around 15 miles outside of town here. And they have a chronic problem with this. This was some years ago. They appear as small papules on the abdomen and on the inner thighs. And these tend to enlarge, and they'll form plaques, and they'll become crust-covered and form little craterform lesions, similar to what you see here. So we have these large, we have the small papules maybe here. Here are some of these craterform lesions. And then the lesions tend to expand centrifugally. They move out, and they coalesce. And you'll get this type of pattern here. And they usually have raised red margins. They have a depressed center. And these have usually a bit of a crusty type material within them. Sometimes it's yellow, sometimes it's dark brown to black, as we see here. But here are some very early lesions. Right here is another papule right here. And here's one that looks like it's forming a small pustule, which in fact it is. And that will become depressed and give rise to these craterform type lesions. This is a more advanced stage again. Now, you see we've had coalescence of multiple lesions. So we have these raised red borders, and we have this crusty type material here in the center. This will eventually become normal. This material will slough off, and about all you'll see, at least in this area here, is a bit of hyperplasia. The lesions are often described as being mainly on the abdomen and whatnot, but they do expand, and they will involve the perineum, extend down the legs, and they can extend up over the back and up on the ears, but that's rather atypical. In my experience. Histologically, the initial lesion essentially is a superficial perivascular diffuse type dermatitis. That's what. So it's not specific for pityriasis, and one sees a degree of leukocytic exocytosis. In other words, what we've got a bit of edema here, not much congestion at this slide, but we've got leukocytic exocytosis, so we've got infiltration into the dermis. Even at this stage, there's a bit of epidermal hyperplasia. Eventually we'll get the beginning forming of some spongiosis and formation of small pustules within the epidermis. This is a little higher magnification. The infiltrate in this consists mainly of neutrophils. This a little further along now, the epidermis is down here below, and you can see here what would be a spongiotic pustule developing. And in fact, up here we probably had multiple pustules, and here we have a bit of a necrotic or serocellular crust forming on the surface. This is a little further along again, and we have a surface accumulation here. And even further along, now we've got a pustule that's being shoved off. And here's that other spongiotic pustule developing below it. You may see actual areas of necrosis and actual erosions and then ulceration extending down as we see here. So we've got a thick crust here. This would be that black material that we saw in those previous slides, the growth slides. And then we have healing occurring, and healing is mainly at least the chronic stages. It's a hyperplastic or acanthosis, if you wish. It's an irregular to irregular. Sometimes it even takes on a pseudocarcinomatous appearance. And we have a thick parakeratotic hyperkeratosis with a crusty exudate up here. So that's pityriasis rosea. The other disease that I want to say a few words about is Dermatosis VEGETANS. Now, Dermatosis VEGETANS, again, I've never seen a case, although I said at Michigan State when I was a student many years ago, I saw a case of giant cell pneumonia, and I'm wondering if that animal did not in fact have Dermatosis VEGETANS. The disease itself is an autosomal recessive disease, and it's characterized by three things. These effervescent, or if you will, flower-like proliferations involving the skin. We'll have hoof abnormalities, and at necropsy also giant cell pneumonia. I was going to ask Sam, have you seen this? Yeah?
The last case I saw was about 1971.
So it's been many years. So you saw the real thing. Oh, great. Well, it's originated actually in the Landrace breed, and in Sweden's back in, said here, 1953, and then they exported it to England. Then there was a flurry of reports about that time, and then it got into Canada, and another flurry of reports. Lesions themselves can be present anywhere from birth to about 2 to 3 months of age. The foot lesions, as we see here, are almost always present at birth. And skin lesions, we do have one here. I think this is a little more than a newborn hair. Can be maybe present at birth. They usually develop, if not present at birth, by 2 to 3 weeks of age, but they can be delayed as long as 2 to 3 months. And what we see here, oops, let's back up here. The feet lesions, they often are described as being club-like, and I think you can appreciate that. And the forelegs or forefeet are always more severely affected than the rear quarters, as we see here. There's a degree of edema of the feet themselves, especially along the coronary band, and one may see the development of furrows and ridges in the hoof walls themselves. Now that's not apparent in this particular one. The hoofs themselves, or the soles I should say, are covered with a very thick, brittle, horny type material. And sometimes that will peel off a bit. The skin lesions develop on the abdomen and inner parts of the thigh, and they appear as more or less circumscribed. They start off as small pea-sized red papules. But these soon give rise to small pustules, and these pustules, just as we saw in Pityriasis rosea, will develop small depressed centers with a brownish to blackish or even yellow type material. They expand just as we saw with Pityriasis rosea, and they form these confluent larger lesions. And this is they may become quite proliferative, and in fact they develop into a vegetative stage in which the lesions are thick, and they develop a very hard surface. They crack and they form fissures. They're lichenoid, in other words, and covered with a black crust. And they can extend up from the abdomen over the other portions of the body, as we see here. So this is Dermatosis vegetans in the gross appearance. Histologically, the initial lesion usually starts off as a bit of a congestion. There's going to be a bit of leukocytic infiltration into the surrounding dermis. There may be a bit of proliferation. Within 2 to 3 days, however, the dermis will show some infiltrate of neutrophils and leukocytes and mononuclear cells, and usually there is a large number of eosinophils. Large numbers of eosinophils would be present, and so that's what we're seeing here. In fact, this is a ectochrome slide, so the eosinophil, the color is not quite as good as it would be with Kodachrome, but many of these cells here are in fact eosinophils, and these will immigrate or in through the epidermis, and they will develop into pustules within the epidermis itself. So here we have some spongiotic type of pustules being formed. There is associated with this a degree of epithelial hyperplasia, and there will be, in the later stages, hyperkeratosis, and this is the type of lesion one sees in the later stages of the lesion, with a very irregular, almost pseudocarcinomatous type of acanthosis, or, if you will, epithelial hyperplasia. The keratin may, in fact, include the hair follicles, and I don't have a good example to show that. This is not from air, but you'll find these type of plugs within the hair follicles, and if you have sweat glands present, they'll also often be cystic. The next disease is a bacterial disease, and many of you that work with pigs in areas of Indiana, Iowa, where I've seen examples of exudative epidermitis, and I thought we'd just show this because it is a relatively, in my experience, one of the more common bacterial diseases. The organism, of course, is Staphylococcus. The evidence now suggests that this produces an exfoliative type lesion, and there's a lot of literature on this, but this toxin that's been demonstrated by some people tends to bind to the filaggrin, which is in the keratohyalin granules, and this material apparently is a protein which is necessary for the aggregation of acidic and basic polypeptides, which are responsible for the formation of intermediate filaments, and these presumably would be out at the desmosomes and allow for attachment. If there's a failure of formation, of course, you're going to have exfoliation. The disease itself occurs in two forms, chronic or an acute generalized form. This is the most common form, and generally you see this in pigs 1 to 4 weeks of age. And then more chronic multifocal form can be seen in pigs 4 to 8 weeks of age. The disease is generally introduced into a herd, into a non-immune herd by a carrier, and then it spreads among the susceptible pigs. Skin abrasions, fighting, bite wounds, whatever, predisposed to this, even coarse bedding or rough crates. Death is due to dehydration, protein electrolyte loss, and cachexia. Grossly, the initial lesions start in the acute disease, begin around the eyes and the ears, and the snout, and the lips, and this is not exactly in the very early stages, but we can see that we've got some small erosions and crust being formed around the eyes here, over in the snout, and actually these are beginning now to extend down the neck. They develop as small red moist papules and become eroded and covered with this yellow-brown malodorous and very greasy type material. The lesion extend down to the legs, as we note here in the ventral thorax. There may in fact be ulcerations here, and possibly even got some secondary bacterial infections with spirochetes could even occur. They extend down the abdomen. Oh, this is the bottom of foot showing lesions in one such case. And they become generalized, as we see here. Usually within 20 to 48 hours, sometimes a little longer. If the pig survive for several days, the exudate begins to dry, the skin becomes wrinkled and fissured, and small cracks developed, and sometimes these are described as being small furrows developing within the skin itself. And in fact, I think here you can see these furrowing where there's separation of the hairs here. And this is that moist exudate which has become dried on the skin itself. Histologically, the initial lesion is develops as a interfollicular subcorneal pustule, and then this develops into a superficial pustular folliculitis. In other words, it involves just usually the ostia of the hair follicle itself, and then extends down very often into the hair follicle itself. Crust form over the surface, and these are composed of necrotic debris plus an ortho and keratotic or parakeratotic epithelium. This is a little higher magnification showing, in fact, that in addition, within the dermis itself, there may be some congestion and a perivascular dermatitis. There is epithelial spongiosis, neutrophilic exocytosis. I don't have a good one here to show you a spongiotic vessel, spongiotic pustule that is, but there is a degree of edema here and congestion. There will be epithelial hyperplasia. This is part of a hair follicle. We're actually getting accumulation of this parakeratotic, or excuse me, serocellular crust, and very often these crusts contain large numbers of bacteria, and if we put some coccoid bacteria, and if we put special stains on here, gram stain, they'd be very easily demonstrated. In fact, I think you can even in an H&E section appreciate that there's large numbers of organisms. Here we go right here. Here's some colonies, large numbers of organisms. Chronic lesions, essentially, again, we're going to have a marked irregular to pseudocarcinomas or pseudoepitheliomatous, if you will, hyperplasia. There will be a mononuclear perivascular dermatitis, crust formation, and parakeratotic hyperkeratosis. So that's exudative epidermitis. Now, Dr. Stevenson talked a bit about erysipelas, and this is somewhat of a repeat in a sense. He showed you a few slides there, but erysipelas is due to erysipelas rhizopathi. The disease occurs in pigs less than 3 months of age and older than 3 years of age, and there appears to be, these at least seem to be predisposed. This is possibly due to natural acquired lactogenic immunity, and then in the later stages possibly due to an active immunity developing in subclinically infected animals. Clearly, this is not a diagnostic lesion for erysipelas, but rather for septicemic conditions. But in the acute phase, there's often a purplish to bluish discoloration of the skin, and especially of the ears. And if you flip this pig on her side, you'd probably find that there was the abdomen was somewhat cyanotic, and even the extremities, the legs. Now you may see small pink, well, this is a little bit more advanced, a little pink macules and papilla. I think we can see, well, we can't really see them here either. But up in these areas here, possibly we may have some small pink maculas and papules developing. And then in the later stages, we get erythemic papules and wheals. And these lesions take on a rhomboid, if you will, or so-called characteristic diamond shape, and they're swollen, and they range in color from a bluish color to a slightly purple, or sometimes even, as we see here, more of an intense magenta appearance. These lesions may spontaneously regress, or the disease may continue on to the chronic stage, in which we get sloughing occurring. This is a little animal, or this animal is a bit further along, and there probably has been some necrosis and sloughing here of the ears, the tails, and even some of these areas here. Histologically, what one sees in the acute stage is dilation and vascular engorgement, and this involves the dermal vessels. There's a bit of a perivascular dermatitis here, and there's neutrophilic infiltration. In the subacute and chronic stages, there's an additional development of a perivascular dermatitis, and actually vasculitis involving especially the arteries, and thrombosis. And that's what we're seeing in this case here. This is a little further along. This is one of our chronic cases, and we can see there's a perivascular dermatitis, and I think you can see these hyaline thrombi that Greg talked about developing within the vessels. This is a little deeper into the dermis itself, and here we see a small arteriole here, and there's one over here and here. And at higher magnification, we can see these, they're more or less hyaline here, but this has become a cellular thrombus. There is a bit of inflammatory cell infiltrate in the wall. It isn't too prominent in this particular case, however. And this little higher magnification showing that mixed thrombus there. Now this will result in ischemic necrosis, and this gives us, because presumably of the vascular pattern to the skin itself, the distribution of the vasculature feeding the surface, it gives rise to the typical rhomboid type lesions. Now salmonellosis is another example of a septicemic diseases that can give rise to skin lesions, and there are a number of others. This is by no means the only ones. I think Greg mentioned actino can do the same thing, and a few other diseases. But septicemic salmonellosis, we mentioned earlier that the big one now is Salmonella cholerae suis. In terms of the occurrence here, it's rare, and I think Greg mentioned the same thing in suckling pigs, possibly related to lactogenic immunity, and it's mainly in weaners less than 5 months of age, but certainly it can be occasionally seen in market and older breeds of animals. The classic lesion is, as he pointed out, is this cyanosis here, and then Greg also mentioned, and I think that's evident here, that what we get is the cyanosis may be quite marked, and we may even see, even at this early stage, evidence of gangrene, ischemic necrosis, and we can see even on the snouts here of this particular animal. The ischemic can lead, of course, to sloughing not only of the ears, and in fact this does occur in the more advanced stages. Here we have one here where we've got a good line of demarcation between the viable and the necrotic ischemic tissues. These will slough off. They're moist sometimes. And here we have one here where we have sloughed the tips of the ears. And there's a bit over here. This one's probably going to slough off in a while. Histologically, this is from an ear from an affected animal. And we're going to see similar changes to what we saw in the erysipelas. You're going to see in the initial stages certainly congestion. There's going to be a vasculitis involving, in this case, small capillaries and veins, thrombosis, as we see here, and of course a coagulative necrosis. And I think you can appreciate that in this slide here. A little higher magnification showing the thrombosis. That's probably in a small arteriole, but here we have maybe some capillaries And here we have the necrotic tissue here. Oops, back to me there. Okay. Let me just flip it back here for a minute. This takes a little bit. There we go. Okay. Another disease that occasionally seen, I haven't seen a lot of it. Rarely have I seen it come in the diagnostic lab. Usually it's something that appears in the field cases, but in a ringworm or dermatophytosis. The most common cause of this in swine is Mycosporum natum, but Trichophyton verrucosum can be responsible, and occasionally other species of Mycosporum as well as Metagrophytes, T. Metagrophytes may be involved. All ages are susceptible to infection, and let me flip ahead here. Generally, in general, we can say that the lesions are often single, but they may be multiple. Here we happen to have a couple single, relatively large lesions, and often they're present on the dorsum and on the lateral aspects of the body, but occasionally they'll be even in ventrum. But this is usually contact spread. Initially, they appear in the early stages as small reddish-brown circular lesions, but these tend to enlarge, and they become, as is evident in this particular slide, with a very dark, crusty type material, as we see in these two pigs. And this is a close-up of another animal showing same type lesion. Microscopically, I didn't have an example from a pig with this, so I picked one from a dog. Being honest with you, these are compound follicles, obviously, so this is not a pig. But the classic lesion that one sees in ringworm in most species is that of a folliculitis, and then the animals develop a parafolliculitis and furunculosis. In other words, the follicles tend to rupture. And at higher magnification, you can always, depending upon the organism itself, but very often you can demonstrate it's not evident in this one, small hyphae, and then arthrospores may be present around the periphery, and that's essentially diagnostic. With special stains, of course, the organisms are readily demonstrated. There are a number of vesicular diseases, and I simply put these in here. I don't have any good materials on these, but we just want to remind ourselves that we need to be aware of these diseases, and there are a couple of them. Greg showed you one earlier. I don't think he talked about it as being vesicular exanthema or one of the other vesicular diseases, but there are 4 that pigs, of course, are susceptible to, and that is, of course, foot and mouth disease, which is a picornavirus. Aphthovirus specifically is the genus. And there's different ways of transmitting these diseases. Certainly, in the case of foot and mouth, the aerosol is the most common, but it can be transmitted by contact with fomites. Swine vesicular disease is another one we need to think about. Again, it is also a picornavirus. Enterovirus is the name, and contact, but again, other possible modes of transmission. Vesicular stomatitis is a rhabdovirus. It is a the genus is Vesiculus virus, and transmission probably is by insects, but contact, bites, fomites, and other modes of transmission are certainly possible. And finally, vesicular exanthema, which is a calicivirus, and transmission is usually by oral, but there are other modes as well. It should be noted these are all single-stranded RNA viruses. The lesions themselves, oops, didn't mean to do that. Let me flip back here. Essentially, regardless of the virus, and I'm sure there are exceptions to this, but I think in general we have to recognize that it's pretty hard to differentiate based on gross or even microscopic appearance of the skin lesions themselves. Grossly, the diseases produce vesicles and erosions, which become ulcerated on the snout, the lips, the tongue, and the oral mucosa, and along the soles of the feet, and possibly sometimes even extending, involving the belly and the teats and the prepuce in the case of males. This is an example of one of these. I don't remember which one it was, but we also develop lesions on the foot pads, and there can be sloughing, as we see here. Microscopically, I don't have any examples to show you, but the microscopic general features are those that we've listed and also in your outline, which consist essentially of dermal congestion, of perivascular dermatitis in the early stages. You're going to have leukocytic exocytosis. Oops, wait a minute. Leukocytic exocytosis and intracellular edema. In some cases, mainly it's, or intracellular edema in some cases, but intercellular edema is usual. You'll get epithelial necrosis, spongiosis, and possibly reticular degeneration, in which the cells rupture and they fuse and they form the larger vesicles. Then we'll have interepithelial vesicle formation. The vesicles rupture, you'll get more infiltration with leukocytes and serum, and finally ulceration. This is a, excuse me, let me flip down here. This is a diagram. Let's see, that's not going to show up too well there. Let's see if we can darken it. Well, it's not going to show up. I can't adjust the color on this portable, but this kind of is kind of a summary of the different stages. In other words, what we've got here is we've got a superficial dermatitis with congestion, some neutrophilic exocytosis. We've got spongiosis, intercellular edema, rupture, reticular degeneration, if you will, formation of vesicles. These will rupture. We get additional infiltration with leukocytes, and finally you may even get ulceration. Oops. Another viral disease, probably one of our more common ones that we see, is swine pox. Swine pox belongs, of course, to the family Poxviridae, and as Suipox virus is the specific genus. Of course, this is a worldwide distribution, and the disease itself, of course, as most of us recognize, is pretty much endemic in any area where you have intensive swine production. Transmission, the sucking louse has been implicated in many of the situations, but contact, and even some people have suggested, I was reading recently of a transplacental transmission in neonates. Grossly, the lesions, typical distribution, they start on the abdomen and involve the ventral and lateral abdomen, but they extend up and involve the lateral portion of thorax and then the thighs themselves. But as is evident in this case, generalized distribution is not that uncommon. The lesions themselves start off initially as small papules, red papules, which enlarge. And here's a small papule here, and they'll enlarge, and they'll become somewhat umbilicated, as we see here, and crust-covered. It's possible to get secondary bacterial infections as well. Here's some more advanced lesions where we have these large umbilicated lesions covered with these thick brownish crust. And lesions to be indicated can extend up, involved in many different portions of the body, generalized lesions involving here the rear of the legs, up around the perineum, and even up on the head and the ears themselves. Secondary bacterial infections do occur and can complicate the situation, as occurred in this particular case. Histologically, the morphologic alterations are characterized within the dermis initially by mainly a superficial perivascular dermatitis, but it does become diffuse. There's congestion, edema, and leukocyte infiltration. Epidermal changes are characteristic of pox virus, as you've seen in other species. That is, we have a acanthosis, that is epithelial hyperplasia. There's often swelling and hydropic degeneration of individual keratinocytes. You can have reticular degeneration occurring, but we don't get the distinctive vesicles we see with the vesicular diseases. That's usually not characteristic. There is leukocytic infiltration, or as we indicated, and in addition, if you look very carefully, often, let me flip to a little higher magnification here, you can demonstrate the intracytoplasmic inclusions. Surface necrosis occurs with accumulation of a serous crust, and I don't have an example of that, I thought. Oh, that's the last slide. Accumulation of a serous crust. Leon, could you change slides for us there? I thought I'd throw in a few other things here. One is thermal injuries, and let me flip back here. Thermal injuries are uncommon, at least in my experience. At least I don't see very many of them, but occasionally we do. This one came through the post-lab, the diagnostic lab some years ago, and these sows apparently, or I think these were sows, apparently got on some hot gratings. Dale, were you here when these came through? You don't remember those? Well, burns can occur in bonfires, incidental contact with hot liquids, if you will, or metal objects in the steam pipes or gratings. Apparently, in this particular case, there were some gratings which were became intensely hot, possibly because of a short circuit in the electrical system in the barn itself. And these animals, this is from two different animals, were lying down it, and as you can see, we've got fairly significant burn. Burns themselves vary in intensity, and there's a grading system. Some people, if you read, for example, Scott and whatnot, use a grading system in which they have a very superficial type of burn, a mild burn, and he talks about full thickness type burn. But if you look at Jubb, Kennedy, and Palmer, they still use the old system. And in pigs, I guess, it's still valid because their skin, it's based upon the presence and development of vesicles. And even grossly, the very mild burns, first-degree burns, usually the only thing one's going to see is a bit of erythema of the skin itself. If you get moderate burns, there'll be erythema, but in addition, there'll be more edema and possibly even vesicles formation. And in fact, probably we shouldn't say possible. In fact, that's the characteristic feature of second degree. Third and fourth degree burns, which is what we're seeing here actually, is we get black necrotic, black-brown necrotic material present, and there will be sloughing of the tissues itself. Microscopically, a first-degree burn, when we look at it histologically, usually the epithelium itself looks pretty good. If you look at it closely, you may, and compare it to a normal area, you'll see some increase in the cytophilia. But there is prominent, very often, congestion of the vessels, and in areas where there's not an abundance of collagen, as we see here, there may even be a degree of edema. Oops, sorry about that. Didn't mean to hit that. Meant to push this button. Too many buttons. In a second-degree burn, what we see is the epithelium now is more acidophilic. Now, of course, these look pretty much the same as the previous one, and I really can't, I don't have a high magnification or a normal area to compare with. But you will see pycnosis and even karyolysis. You may see intraepithelial vesicle formation. There's a bit here, but usually, as shown here, at least in the case of pigs, there's subepidermal vesicle formation and accumulation of a bit of a serous protein and a few inflammatory cells. The dermal alterations are the same as you see in a first-degree burn, where you simply have congestion and perivascular infiltration with inflammatory cells. Oops, sorry about that again. I meant to push this button. In a third-degree burn or full thickness type, what one gets is coagulation necrosis of the epidermis, and this will extend into the dermis, and we'll have, in addition to congestion, there may be even some areas of hemorrhage. There may be some over here, and inflammatory cell infiltration. Fourth-degree burns, the only difference between that and the third-degree burn is the lesion extends down into the subcutis. The last group here is phototoxicity or sunburn or solar dermatitis, and this occurrence usually occurs in pigs that have not been previously exposed to sustained sunlight, and usually it occurs in light-skinned pigs. These pigs here have sunburn and occurs often over the back, but it can extend down and involve the head here and the tips of the ears, as you notice here in these pigs here. Grossly, the lesions that I note here occur along the back. They develop as areas of erythema initially, and there's scaling and then sloughing, or peeling and sloughing, and it may involve the tail itself or even portions of the ears. Histologically, there is a superficial perivascular dermatitis that's present, and if you look at the epithelium, there will be a dyskeratotic keratinocytes deeper within the epidermis itself and in the superficial portion of the dermis. There will be a infiltration with leukocytes. That's a incorrection there. I said that it occurs in light-skinned pigs, but occasionally you will see it in dark-skinned pigs, and this is one here in which there was, in fact, sunburn involving a dark-skinned animal. That pretty much concludes this section here. Are there any questions that I can address or any comments? I'd like to hear what Sam has got to say about dermatosis vegetations, if he has anything.
I must say it's really sore about, I think it's about 18 pigs altogether, and about 3 pairs of bull and sow in the field. The lesions were exactly as described, except that Albert wasn't really affected enough. It didn't reach that age, so we never saw those big lesions.
Yeah, we've got other photos, and I didn't show those, where they become almost cauliflower-like, involving the legs. They can be, and I didn't bother to bring those with me. I tried to limit the number of slides. Dale, have you seen any over in your area, or any of these others? You see pityriasis rosea very much?
With some frequency, but probably staph dermatitis is the worst thing we see. Although I had a guy call me, was an owner, call me, he said he's had a bunch of pigs outside in the spring. Mentioned that there were Cargill units and that they just started to spend more time outside and stuff. And he said his sows would go out and the boar would go over to mount and the sow would just buckle underneath and wouldn't let him mount and would walk away from the boar even though he knew they were in heat, standing heat. And these sows had been sunburned. They would not let these boars mount. So,
do they have kind of a stiff gait too and trouble walking?
Well, I don't remember what he said other than that, but I mean it was pretty. I mean, that was the thing I thought about was sunburning. He didn't think that it was possible that was a problem, you know. But I mean, so it can be a problem in more ways than one, and nothing got red, I'm sure.
You sound like you have it down in Georgia quite a bit. Do you see a fair amount of it down there?
Yes. One question I had, though, was on exudative epidermitis. Do you often see kidney lesions with that? They're described in the literature.
Oh, I've seen in kidney lesions. I think most of us have. Yeah, I've seen. Yeah.
With what degree or frequency?
Oh, I couldn't. Greg could probably tell you. He's the expert on percentages. The question was, what percentage of exudative epidermitis do you see renal lesions?
I don't.
Wild guess. 1 out of 100 cases, or?
Well, I guess I probably haven't tried to put together statistics, so I really don't feel I'm qualified. You know, I can't say. I don't know.
I looked for it for a long time, and it was several years and got to find one.
I never saw it.
I looked for one until I found one I could take a picture of, and it took several years to find it.
Dr. Harrington, I work for FSIS, and we get probably the most common skin lesion we get are cutaneous melanomas, but the next most common we get are presumptive diamond skin lesions. And when I was in St. Louis getting a lot of skin specimens from the big pig country here through here and west, I guess, to Iowa, Nebraska, and Kansas, we got a lot of these, and they were just foci of eosinophilic dermatitis. Does people have ideas of what's a good?
We see it with sarcoptic.
A good differential for that?
Yeah. Well, I didn't show any. You can with mange or any of the parasites allergic reactions. You might see that. I didn't show those. I had some, but I was limiting myself because, as I said, I thought Greg was going to run over. Blame Greg. But Greg, have you got any comments on what are you going to say?
Yeah.
She was talking about the eosinophilic dermatitis.
And they really look like diamond skin grossly.
Talking about focal?
Well,
dermatitis?
Right, well, these would be multiple foci.
Right. Well,
Looking like diamond skin.
well, I got involved in one with the slaughter plant, long story, but a local slaughter plant where they had 2 farms that they were having high percentage of those in the summer. And they were...
Yeah, these were mostly in the summer.
They were on the ventral and the driver's skin, and there were multiple foci. They were red matches after they came through the skull.
Right.
You couldn't really see them until they came through the skull. Microscopically, some of them, all of them look like northern Minnesota mosquitoes. I didn't know mosquitoes got that big. I mean, you know, when you're talking 2-inch wingspans, they were that big.
Well, that's the national bird, isn't it, Minnesota?
You know, I'm not an insect guy at all. Yeah, they were honestly, you know, lengthwise, they were probably more than a half an inch. And they gave us, I can't remember the genus and species, but they were basically a huge mosquito. And so they were only penetrating on the glabrous part of the skin of these animals. Dr. Harrington?
Yeah.
I got a question for you. In regard to PITYRIASIS rosea, you know, I guess I always thought that, and I might be wrong, because I'm not that great at skin, but that the inflammatory reaction was described as being significantly eosinophilic cardiovascular dermatitis in those. Not true? I know you said that with dermatosis vegetans.
Dermatosis vegetans. I have seen some, but I never thought of it as being mainly eosinophilic. I don't know, is anyone else, in my experience, you know, they describe eosinophils, but I know in dermatosis vegetans, it's definitely eosinophilic. I mean, there's neutrophils there as well. So.
Back to the insect bites, we wrote up, when I realized it from our laboratory, they wrote up a report about yellow jackets causing insect bites.
Yeah.
And they had built a nest under the edge of the slab.
Right.
And they'd dig around the edge of the slab and stir them up and it'd sting them.
And the ears and whatnot?
And over the body.
I think Michael Hill has a slide of that. Just probably came from you.
Barry Stewart
And right. In fact, I had that. I borrowed the slides from them, and I thought maybe I might show this. But they have these black ears with a very large weltsome and necrotic centers and whatnot. Yeah, I did see those slides. But flies, irritating flies, mosquitoes that Greg has already mentioned, ticks occasionally can all cause problems. Leon, did you want to comment?
I'm just wondering, back a number of issues ago of swine disease, they spoke to a spirochetal gland, and we've seen a few of these things through here.
Yeah.
I'm wondering, talking to Stan, he says that they now isolated the spirochetes from these hairy warts. I'm just wondering if it might not be a similar kind.
I believe it's Borrelia suis. That's what that spirochete is.
I don't know whether it's the same thing or not, but we could see when we saw them. When we saw these things, they had a tremendous number of spirochetes.
Yeah. Is that the one that we have the sections? I mean, the slides again. I didn't put them in here, but there was some ulcers and dissecting subcutaneously. Is that the one you're talking about, Leon?
It's pretty prolific.
Oh no.
We saw in the swine.
No, that's the one I'm talking about.
Just curiosity. I may not be closely related, but don't see it very often.
Are there any announcements? Well, how about the vesicular disease? You worked with some of these out there, didn't you, in Plum Island?
I didn't work with them personally, but they are difficult, very difficult to.
Were there any characteristics that you would recommend to say that you could differentiate them microscopically or whatever?
If you had a big outbreak involving a number of cloven-hooved animals,
Yeah.
I would be thinking FMD versus the others.
Yeah.
But
I mean, based upon the morphology of the lesions themselves.
Dr. Meevis talked about that a little bit, being an FMDV had a little bit different pattern to it. I think it's more superficial than the others, but he wasn't always convinced. You got to catch him at the right stage early when before the vesicle's broken. And,
Right.
not that I know.
Okay, thanks, Tony. Well, are there any announcements to be made?
Yes, thank you, Dr. Harrington. Evening will adjourn for this afternoon. We do have, remember, a 2-hour session beginning at 7 o'clock tonight. We'll cover diseases of pet birds, so don't forget about that. We do give you one night off tomorrow, I guess, and have a banquet on Wednesday. So I guess we'll adjourn for now and see everybody at 7 o'clock tonight.
Dr. Snyder, can we leave our notebooks in here?
Yes, I think that'd be